Welcome back, and you can see our two guests here today, one of them very familiar to us, Dr. John Hovhanessian, Harvard Eye Associates. Nice to see you again.
Great to see you again, Ken. How are you?
Good, and you brought along a new doctor.
I did.
Is coming onto your practice over there. Dr. Brian Kim, welcome.
Well, thank you for having me.
Nice to have you here.
Thank you so much.
We have, as you know, Harvard Eye Associates has been growing for a number of years. We have the world's nicest patients who all send us their friends and relatives for their eye care, and so we have grown in a way that is in the direction of different specialties in eye care. And Dr. Kim, whose name is familiar because his dad, Ed Kim, has been part of our practice since practically its beginning, has joined us, but brings a new specialty that we haven't had before, and that's retina. So many of our patients have retinal disease, whether it's macular degeneration or diabetes or other problems in the back of the eye, that we really needed that specialty at Harvard Eye, and we're really pleased to have him because Brian's been a wonderful addition to the practice. Now it's about 3 months that he's been with us, 2 or 3 months, and it's been a great addition.
That's great, following in the dad's footsteps.
Yes, yeah.
And where did you train?
I've been sort of all over the place, but I did my ophthalmology training here at UC Irvine, and I did my medical retina fellowship in Bascom Palmer in Florida.
So very good.
And Brian's being somewhat modest here because Bascom Palmer is considered among eye specialists to be the leading training program in the country across the board, and so the University of Miami's program where Brian trained is the top place in not just retina but a number of other fields of specialty. And so he's extremely well trained and has been just great with our patients. So has great skill and some information to share today too, I think, about macular degeneration.
Yeah, I thought I would talk today a little bit about the biggest concern that most of my patients so far have been asking me about, and that's macular degeneration and vitamins, and what can I do to keep my eye health and prevent macular degeneration and losing my vision. Macular degeneration is something that affects us all. If we all live long enough, we all we're prone to aging effects of the eyes, and macular degeneration is such a problem. The common misconception is that it causes total blindness, and that's actually a fallacy. It does not cause total blindness. It can cause reduced vision with time in the center vision, but you always keep the peripheral vision, which is important for functional day-to-day routines. So how do we prevent that? And that's the biggest question. And today we just thought we'd talk a little bit about vitamins and nutritional supplements and dietary changes that we can make to help to prevent that from occurring.
So vitamins, we've always heard about eating your carrots and that kind of thing, and in the vitamins that are in there. There's some truth to that, I guess. Certain vitamins do really help. Oh, by the way, this is what somebody would see. Am I right?
Absolutely. This is sort of an advanced. This is what we consider an advanced stage macular degeneration. This is either wet or dry, but this is a very advanced stage of macular degeneration. But as you can see, you really do keep your peripheral vision, and that's enough to get around and do the things that you really need to do.
Yeah, my brother-in-law's dad has something like this. It's caused by something quite a little bit different, but he can't drive anymore. But he still goes out there and plays golf as best he can with the help of his friends, and he still gets around.
Sure, absolutely.
So, the vitamins, are there specific ones? You have a list here.
Yes. It's there are certain. This has been extensively studied over the past 10 years, and in very well-controlled studies, and the biggest one being the AREDS, and this is a brand new study. This is a secondary corollary to the first study, which is the AREDS 2, and this first came out in May of this year. And basically, it's advocating vitamin C, vitamin E, zinc, copper, lutein, and zeaxanthin, which are very similar to beta-carotene.
Okay.
Which was previously recommended,
yeah,
but no longer because of certain individuals can't take that.
Okay.
So,
the actual vitamin you're talking about.
The actual vitamin, that's correct.
Because they had a beta-carotene vitamin, don't they?
They do.
A specific one just for okay.
They did, exactly.
Yeah.
And people who were smokers actually had a slightly increased risk of having lung cancer. So
oh, wow.
they simplified the whole regimen, found that lutein and zeaxanthin were equivalent, made the whole thing much easier. So we just recommend that now. So vitamins are very confusing because right now we're in a state of transition.
Yeah.
And because this is a new study, all the vitamins are the brands are keeping up, and they're starting to come out. So you want the newest ones. So if they say new on it, those are the ones you want. I wrote down that previous slide all the dosages, and I don't want anybody to belabor the details of that, but I just remember it like this: Centrum Silver and Preservision with lutein. And I have no financial interest in either of these companies, but these two together, if you look at the vitamins and the dosages for each of them, is equivalent to what you should be taking.
So Centrum, we've all heard of that. They've been around for a long, long time.
Correct, yeah.
And of course, Bausch & Lomb, anyone who's using different types of the contact lenses and all the other stuff they make, the eye drops, will be familiar with that name. Obviously, the Centrum you can buy anywhere. You can buy it at the grocery store. What about the Bausch & Lomb?
They are both over the counter.
Oh, they are?
They're both
Okay.
widely available, yes.
And who should be taking these? Now, of course, the Centrum, I think a lot of people, it's a multivitamin.
Sure.
Probably at a certain age, will say, what the heck, I'm going to take it. It's probably not going to, unless they have a certain adverse effect to something that might be in there,
Correct.
Why not take it? But the Bausch & Lomb one is very specific. So does that mean you should go to your eye doctor first and have it recommended, even though it's over the counter?
We haven't studied this extensively. Certain vitamins, like vitamin E, if you supplement in addition to this, high doses, very high doses of vitamin E, we know can have deleterious effects. So we want to watch the levels of vitamins that we do take in. To start with, if you take these vitamins, we think that there shouldn't be any adverse effects to it. In addition to a healthy diet, I think that this is beneficial pretty much for everybody. In the studies, it has showed no real effect on the eyes per se until you've reached a certain middle, intermediate stage macular degeneration. However, it doesn't really hurt if you're taking these vitamins before having developed macular degeneration. To slow down the progress.
Yeah, and I'm sure you would agree with this, that if you have some other condition, maybe you're taking blood thinners or things like that, to at least bring that to your doctor and say this is vitamin E, it's this kinds of things, and check things out. Obviously, I like this slide a lot because the reason is not only because I love salmon and greens, but because you often hear that if you can get your vitamins, the vitamins that you need from your food, your body metabolizes that better. And what better than a salmon here, and you've got the greens, the chard, and the asparagus, and all that.
That's correct. The darker the green, the better. Yeah. So the spinach, kale, chard, Brussels sprouts are really very important as a supplement to the vitamins themselves. You do want to check if you're on a blood thinner like Coumadin or warfarin, that you do check with your doctor before you start increasing your intake of these vegetables, because it can interfere with that. But it's very important for eye health, as long as you can maintain a regular dietary regimen. And also salmon's very high in omega-3s and such, and that's a very important thing to also supplement with 2 or 3 times a week. Has been shown to be very helpful. The omega-3 supplements are good for the eyes, as far as in John's arena, the dry eyes and the oils and the quality of your tear film. As far as macular degeneration goes, the supplements are not as good as eating a regular intake of fish.
Right.
Yeah, we tell our patients if you can have fish 3 times a week, and we're not talking about fried fish. If you take cod and you deep fry it, actually you kill most of the benefit of the omega-3s. It's got to be broiled or baked or in some way that's not deep fried. And a salad every day. If you take a salad that's got some greens on it and a mixture of vegetables, get what you like, then you're probably doing 95% of what you need to do to have the right nutrients to protect your eyes. And it may not be necessary to take a supplement in addition to that. However, supplements don't need to be very expensive, and they can be very effective in making sure that you get enough levels of the right nutrients, particularly the carotenoids, which are the lutein, zeaxanthin, and mesozeaxanthin that Dr. Kim's talking about, to prevent macular degeneration. So there's lots of reasons that Grandma's advice that eat your fish and eat your salad, finish your vegetables was well thought out.
Yeah. Now, when it comes to these supplements, the Centrum and all the other ones, is there a certain age group that's for? I thought if I read the bottle right, it said like 50 and over. Obviously, if you're 40, you can take it.
You can take it. That's correct.
You know, but if the benefit, the way they formulate these, are they for the needs of specific age groups? Is that something you should look at?
Primarily, I think it's mostly our nutritional needs increase as with time.
Okay.
And I think that's more of the reason that they make those formulations. But from an eye standpoint, yes, absolutely, those are the perfect medication.
If you already have it, macular degeneration, would changing your diet or taking these supplements here may not reverse it, but does it help it from gaining ground, getting larger?
Absolutely.
It really does.
Absolutely.
Okay.
It slows the progression and definitely prevents advanced stage macular degeneration by about 25 to 30%, which is a huge amount.
That's a very easy thing to
it's
do.
Very easy.
Very and inexpensive.
That's right.
Yeah.
That's right. That was really the take-home point of these studies,
Yeah.
of the ARIDS study and the ARIDS 2 study, is that among people who have macular degeneration, you can slow the progression of that disease by altering your diet, by altering what you take in. Two other things that are very important. One is smoking. There is just, it is about the worst thing you can do for your risk for macular degeneration if you smoke. So quit now, and the earlier you quit, the better. And the second is wear sunglasses when you're outside.
Yeah.
There is some role that ultraviolet light plays in contributing to the oxidation, the oxidative damage that we're trying to fight with antioxidants by sunlight and other bright light exposure. So sunlight, so UV protection, and you don't need to spend a ton of money on on expensive sunglasses. You need something that fits well and that has good UV characteristics. And a good optician can point you toward those things. And if they're labeled, you'll see on the sunglasses themselves what their UV protection is. They should say UV 400 or 100% UV protection.
All right, very good. Excellent advice and really easy advice to take. It's not, not hard at all. Nice to meet you. I'm sure we'll see a lot more of you. Welcome to Harvard Eye.
Great, thank you so much.
And I'm sure you'll be a wonderful addition and make the dad proud, right? I'm sure he already is.
He's made all of us proud.
Yeah, I bet he is. All right,
Thank
nice
you.
to meet you and nice to see you again.
Nice
We'll
to
see
see
you
you
in about a month, all right? Folks, we'll be back in just a moment.